Thank you for coming. So we'll start the session, and I'll just have a few things to say housekeeping wise. But first of all, I'd like to acknowledge the Whadjuk people of the Noongar Nation, and I'd like to pay respects to the elders past, present and emerging, and also offer our acknowledgement and respect to other Aboriginal and Torres Strait Islander people who are present. So if you can please put yourself on mute until you're ready to ask a question after our interview and presentations. And you might want to turn your cameras off. I don't mind, but it might be useful. Again, please come back at towards the end, or if you've got a question. And you might also want to type a question as well if that works better for you. We'll navigate that. Sometimes it's really easy to navigate and sometimes a little bit more tricky, but we'll work that out. I would like to acknowledge our sponsors, so WACOG of the Cancer Council of WA and the Department of Health of WA. You'll get an evaluation form electronically after the event, and we'd really love you to complete that. And I'll remind you again at the end, so forgive me for repeating myself, but it's quite important that we gear our events to what you want and tailor them to how you expect us to present them. So we'll basically have a very brief overview, a snapshot I've called it, of research in this area of dying, death and bereavement in COVID during the time of COVID-19. And we will have a story, somebody's, a young person, Ashley, story about her losses during COVID-19. And then I will interview Karen Anderson on health professionals, changes during this time, and also the experiences and changes of clients during this time. So that's the kind of format, and then we'll have questions and discussion or pointers or input from you towards the end. So I'm going to start by sharing just a few slides, not very many. I'm just going to see what's happening in chat in case, oh no, we're okay. So I'm going to share my slides. So this is just a snapshot of research, and I just looked at half a dozen, 10 papers, articles, and I've just summarized the research. There are two really good papers that I found, and I will send those round via WACOG through Claire. And one in particular is a beautiful paper, and I'm going to read out a couple of things from that a little bit later on. So as well as the primary losses that people have experienced, either through COVID-19 or the losses that they have experienced through a range of other ways of other deaths, then there were also secondary losses. And one of the papers that I really liked, was talking about secondary losses. And some of these are usual, business as usual losses, sadness and experiences that we go through after any bereavement, but some are particularly salient during the time of COVID-19. So we've got a loss of role, a loss of companionship, a loss of intimacy, a loss of identity, but we've also got a particular emphasis on loss of freedom and autonomy. So some of the things that we expect to do after bereavement, some of the things we expect to do when we experience a loss of a loved one or a family member or friend, we've lost that autonomy and freedom to do those things. We've had a loss of relationships, and that's been exacerbated by a loss of being able to connect with others during that particular time of social isolation. A loss of recreation we've experienced. So it's not just about primary loss or a loss after somebody dies. It's also about the losses that we've experienced as a community. So loss of recreation, support, loss of a feeling of safety emerged in a few papers, which again is particularly salient during this time. Our world seems to have shifted, certainly in many places in the world, perhaps not so much in WA at the moment, but certainly in other parts of the world, the US, the UK, Brazil, a whole range, India, a whole range of places, and of course, Victoria, that loss of a feeling of safety. There's been economic changes, which has resulted in a loss of independence and also a loss of health for many people. And interestingly, I read a paper that indicated that fewer people were going to the GP, and I suppose that makes intuitive sense. I've got a colleague who was diagnosed with type 2 diabetes last year and has not been to the GP at all, not necessarily through fear, but rather not wanting to burden the service. So interesting decisions that what people are making during this time. So lots of secondary losses there. There are also many different types of losses, as we all know. And one of the losses or the limits that people have experienced is a stigmatized loss. So that idea of blame and alienation. And I know this was talked about in research during the peak time of HIV/AIDS, that basically people were feeling stigmatized, and many people working in the cancer arena will know that certain cancers have got stigmatizing features, and this has emerged strongly in COVID-19 from some parts of the literature. There's also disenfranchised grief, and I've long been interested in this type of grief where it's not acknowledged. So with the change in funerals, there is a lack of recognition, or a feeling of a lack of recognition of the loss, a lack of meaning. So it becomes less meaningful to have a funeral when the things that you expect to have at a funeral are not happening. There's a loss of being able to convey love and respect to the person who has died, and also a lack of rituals and a lack of cultural and religious mourning rituals, of which there are many, and in the literature these 4 were particularly talked about, that just could not happen. So a period of grieving. So funerals had to happen very quickly and happen in a different way. And also a loss in terms of hospital restrictions, and in particular not being able to say goodbye. So the literature also talked about a range of emotions, and we will talk about these in our next, or Ashley and Karen will talk about these in our next sessions. But the emotions emerging from this particular period in the literature were that feeling of being unsettled, and that was exacerbated by the constant changes, inevitably constantly changing. So the rules changed, the guidelines changed, the advice changed. We moved into a certain, moved out of lockdown, back into lockdown. So there's a lot of people feeling very unsettled. There's also a lot of fear, and also feelings of guilt. This again has been exacerbated by the distress people felt at times of the devastating stories that have emerged and the scenes on social and other media, including the TV. And that constant vigilance over maps and curves and flattening the curves is really, again, anxiety provoking. There are some positive emotions that were reported, a feeling of people feeling resilient. It's not my favorite term, resilience, but that emerged strongly in the literature, and also creativity. So creating new spaces. Now I want to just read a couple of quotes, they're not very long, from a paper that's called "I May Never See the Ocean Again, Loss and Grief Among Older Adults During the COVID-19 Pandemic." And I'll send this through. And it's just a position piece, really. And one older person said, "I may never see the ocean again, never touch my kids again. How do I accept that?" And another quote, "I have no one to touch me, no one to give me a hug when they see me. It's a horrible feeling." And this 75-year-old woman in a psychiatric facility was saying that she wanted to move and should have moved earlier. And so she felt intense regret over that. So it's a very short paper, but I'll send that round. I thought that was an excellent discussion piece. But we've also got health professionals and clinicians feeling loss. And one loss that was talked about was an ambiguous loss through isolating from families. And there's moral distress through triaging and ethical decision making. I don't know how much of that went on in WA. There was probably plans for it, but in other parts of the world, we certainly saw in Italy that there were decisions to be made which were obviously distressing to the health professionals making them. Use of telephone and video platforms, I think we'll talk about that more in our interview, so I leave that one, but it is there, it's written about. And also the lack of preparation. Again, in WA, I think we were excellent at getting prepared and really making use of the resources that we've got, and people acted very quickly. In other parts of the world, the lack of preparation was just so apparent in those first few weeks and even couple of months. In fact, still prevalent in parts of the world now. So in terms of the literature, there was a whole set of things that people suggested. And again, we'll cover this in the interview, so I won't go through these in any detail. But one paper suggested new personalized rituals. And that probably it happened so quickly that was difficult, but as people in parts of the world are still experiencing this major crisis and transition, then that might be a way forward. Advanced care planning and goals of care, I do quite a lot of work in that area, so I was pleased to see that, and I know that that's happening. Preparation, communication, we all know the importance of communication, and it's even more important now when the decisions that people make may be made with a health professional. Tailored strategies for functional adaptation, palliative care, and let's get this right high on the agenda. We really need to move forward and emphasize and prioritize palliative care for everybody who needs it. Connectedness, so that's social connectedness, and other suggestions were mindfulness, routine, self-care. And I've added this one. I couldn't find a paper that talked very much about this. I will look again, but support for children. Children and young and adolescents and young adults. So I'm not saying that there may be a lack of understanding and a fear from a different place. I mean, moving in and out of school must be very, very difficult for young people, for children. So that's just a snapshot of the research. I'm certainly happy to. I'm trying to work out how to pull these down. So stop sharing. There we go. Sorry. So we can certainly, if you've got any questions, we can perhaps talk about those at the end. But I know we're going to touch on a few of these things. So I'll leave it there if that's okay. And the next person I want to introduce is Ashley Pantaleo, who is a PhD candidate in the School of Psychology, where I am, and also works in the WA Cancer Prevention Research Unit, where I also am. And I know Ashley's got a moving story, so I'm going to put myself on mute and turn my video off, and we can listen to Ashley.
Thanks, Moira. Yeah, so I had a couple of interesting experiences over COVID. Around Easter time, I had a family member pass away from mesothelioma. It was he had a long history with cancer. And then a couple of weeks after that, I had a friend pass unexpectedly. Obviously Moira knew about this story from working with her and everything like that, and she suggested I come and tell it, which I'm very happy to do. So I suppose with my first experience, because my family member had quite an extended history with cancer, there was kind of a little bit of preparedness there. This was a long journey that they had experienced. We knew it was terminal. We knew the end was near. He was deteriorating quite rapidly. But when the end did come close, it was kind of during the point of COVID when the lockdowns were kind of in its infancy, but still quite, they were very strict. So obviously we could not be with even our close immediate family if we weren't living within their household. It was during that time. And my family and I, we had a discussion about what to do, because he chose to be at home right up until the end before entering palliative care for the last couple of days of his life. And we discussed, like within my family where I live, if we wanted to kind of break quarantine and get together as a family, still social distancing, however, but get together as a family to say our last goodbyes before he entered Bethesda. And it was a difficult decision for me, obviously, because I very much adhered to the warnings that the government put out there and about social distancing and the risk that we were taking. But in the end, my decision was made because this was a moment I would probably never get back in my life. And it was a risk I was willing to take at the time. So we did get together as a family before he went into Bethesda, but we still adhered to social distancing. There was lots of hand sanitizer around, but obviously there were other members of our family that were quite elderly. So we put in procedures, let's say, in place within the family that, you know, when we went in to see him to have our individual one-on-one goodbye and, you know, reconcile what was happening, the elderly members of the family were segregated into different rooms away from other people, just because they were just, you know, obviously at higher risk. So we made sure that we each went in when no one else was in the room, and we all sat outside and we entered the house individually. And into his room as individuals, and we said our goodbyes, went out, and it was kind of a very systematic process, trying to maintain social distancing and that sort of thing, but also still trying to have that moment, that one final moment, I guess. And then obviously, yeah, once we had that day, there was quite a bit of distress, lots of grief and crying and realizations, but it was difficult in terms of, you know, we would sit across from family members who were obviously distraught and upset, but we couldn't touch them. Like we couldn't hug them or console them or anything like that. We just kind of had to watch from afar, just out of kind of fear of, we don't know what's going to happen, but this is the best situation that we could make out of the circumstances that we were presented with. And then a couple of days later, well, the next morning he went to Bethesda, and I think the day after he passed away. And even in that process at Bethesda, I wasn't obviously there for that. It was very much immediate, his sons and daughters sort of thing. And family members were informed of what had happened, but they still had strict protocol of how many people could be let in to see him in his final moments, which I think was maybe 2 at that time. So yeah, so that was kind of the process of just before he passed. And then obviously the funeral situation was down to 10 people, I think, at that stage. Like it was just 10 people, and it was a relatively immediate family. And I think his family is quite large. There's obviously a lot of people that loved him. He was a great man. And it was kind of quite hard to reconcile who would attend, obviously immediate family. And because the immediate family was also quite large, people were left out or could not attend the funeral and had to watch online. And that was kind of a little bit difficult, just because, you know, you saw some people go, like myself, I watched it online because there just wasn't enough room for me to attend, essentially. And yeah, it was a very different process of like, it wasn't real to me. It just did not seem real. And yeah, it was kind of, it was nice. Obviously he was remembered in the way that, you know, best suited him, and it was a celebration of his life. But talking to family, you know, that night of the funeral and everything, they said it was upsetting in a way, because this man was so loved, but it wasn't represented by the people that could attend. It was such a small funeral that it didn't seem fitting for who he was, because he was so loved by so many people, and so many people wanted to attend, and they kind of felt a little bit that they were disrespecting him in a certain way, because they could not have the show of support and celebration of his life at the funeral. So, and I suppose like in the lead up to the funeral, I'm probably jumping all over the place, I'm really sorry about that. It was just really hard because I was at home. And I've attended a few funerals in my life, but there's a process, like there's like a reconciliation of what you're going to do the next day when you do have a funeral. Like you plan what you're going to wear, you go through the process in the morning of getting dressed and thinking about it. And, you know, it's like rituals and stages of like mourning, and like in the preparation in the morning of a funeral, you kind of prepare yourself for what you're about to face that day. It's a little bit different, I found, for me online. Like, I was like, do I still get dressed? Do I still get dressed as though I'm attending a funeral, even though I'm sitting at home in my study watching it online? Do I still put makeup on? Do I still do all that sort of stuff that I would usually do for a funeral? Or do I not? Like, is it appropriate? Is it not appropriate? Is it real? It doesn't really feel real. Is this actually happening? I don't know if it is. And it was kind of a funny sort of feeling. But, you know, I chose to go and do what I would normally do for a funeral, which is to get, you know, have a shower, get dressed, do my makeup, you know, that sort of process, and sit down and, you know, have tissues, mourn, and, you know, listen to the life. But then it just, as soon as the funeral ended and the screen shut off, that was it. It was just like nothingness, because I had no one here. I was by myself. So it's not like I could mingle with family and all that sort of thing that happened after the funeral. I was literally like, well, what do I do now? Do I go back to doing my PhD work? Do I go back to work? Do I sit and watch Netflix? What do I do? I don't really know what to do, because it's a completely different environment than I've ever experienced during a funeral. And then, so that was kind of that experience. And then a couple of weeks later, my friend passed unexpectedly. And I suppose it's a kind of paradoxical experience in that with my family member, I was prepared for that loss in a way. It was months of acceptance to a point, and realization that this is what's going to happen. And I just have to kind of prepare myself. Where this one came out of left field, completely left field. And it was, that one probably hit me the hardest, because I did not quite understand what was going on. Obviously, I was still in early grieving for the loss of a family member, and then there's compounded grief with the sudden, unexpected loss of a friend during COVID. And it was, just it was a different experience in terms of processing the grief and trying to work out what happened, because again, I was getting filtered information from my friends, our group of friends, trying to understand what had happened and to make sure it wasn't a joke, or something along those lines. And it was like, lots of calls to friends and to Melbourne to friends and all this sort of stuff, trying to understand what was going on, knowing that I can't actually go and see anyone or go to her mother's house or do anything, trying to understand what had happened. And then when the funeral came around, it was, again, a very similar experience of not knowing what to do. I couldn't go. Literally, her family were quite large, but then over 130 people attended the online funeral. That's how loved she was. And it was just, again, it seemed disrespectful to show that no one could actually be there and do that and show the respect. And our friends, our mutual friends in Melbourne, were struggling very hard with the fact that they were separated from us, because they were by themselves in Melbourne, and they had some issues trying to cope and deal with the fact that our friend died, and they couldn't be in the same city, let alone anywhere else. And only recently, she just got back into Perth yesterday, the day before, in preparation to try and get together with us to kind of have I don't really know how to describe it, get together to try and mourn her death as a group so we can actually be together. This was something that was planned during that time, that as soon as, restrictions were lifted, we would get together and do that as a group, because to all of us, it felt like it wasn't real. It just definitely wasn't real. And I suppose thinking about it and our experiences of people my age, not that I'm like super young, but we see a lot of stuff online. We see a lot of videos. There's a lot of death, dying, grief in the videos we watch on YouTube, Netflix, Stan, all of those sort of things. And I think it's desensitized us to what is really happening. And like, even though we're seeing an actual loved one that we know, it's very kind of, it's not real. It's a very surreal sort of thing. And yeah, I think that was kind of my experiences over COVID. It was just kind of an interesting experience trying to like navigate all of that. And yeah, kind of, yeah, that's kind of my story, if that kind of all makes sense.
Thank you, Ashley. Yes, it does make sense. And thank you for sharing that. That's
okay.
Very moving and very close together, two deaths, people who are obviously different ages. If anyone wanted to type a question into the chat, I can read that out if that works for people. Does anyone have a question? So sorry for your losses, Ashley. Thank you for sharing.
That's okay.
Anyone else got a question? I've got a question to say, if somebody else was going to be potentially going through that in the future, what would be your take? What would be your message to that person? What would you say in terms of how to, I suppose, make meaning out of that?
Make meaning?
Well, what would you say in general, your words?
I think I would say that respect how you feel and how you feel about what's going on in this situation isn't invalid, and you're not strange for thinking it. I would say that you know, I had moments of thinking, you know, should I really be feeling like this? Like, you know, and I was questioning myself and how I was feeling about grief at this time. And I think I had to really acknowledge and understand that I'm in a very unique set of circumstances. It's you know, I've never lived through a pandemic, and I have to kind of be a little bit kinder to myself and, you know, acknowledge that how I'm feeling is totally fine, even if it's a strange feeling, or even if it's feeling that I would never normally feel during grief, or like my experiences at funerals or losing someone. And I would say that just kind of, yeah, be kind to yourself and don't question how you're feeling, just kind of feel it in a way. And also to kind of, I don't know if this was part of your question, Maria, but like cope with it. The way I kind of found my way of coping through it is like, I did find things that I enjoyed. Like, I'm an artist, so I put it into my art, like I created things. And that helped me kind of get out of my head and process a bit of grief. And obviously, and still try to communicate and like have online chats with people, as, you know, try and just keep the connection going, because there are lots of like isolating moments during this type of grief process, and it's really easy because you're not surrounded by people. I couldn't go see my parents because they were just on the cusp of the border restrictions, and even though they were still inside our zone, the Perth metro zone, the police were still very much around there, and I didn't want to risk being turned away from seeing my parents and having to drive all the way back. So I didn't have any family that I could see. So I tried to, you know, make the contact that I did have with them via screen or phone the best that I could for myself, if that makes sense. I'm not really sure. Does that kind of answer your question?
No, it makes perfect sense. That was a wonderful answer. The message is very positive, and thanks again, Ashley. I know it's difficult to share on this platform, but that was really well done.
Yeah. Maureen had a question.
Oh, sorry. Oh yeah.
I can see the chat too. Maureen, It did. It was kind of funny because it was kind of mixed together, because I've obviously had, I was still processing the loss of a relative, but it was, I don't know, it was kind of all meshed together and compounded, if that makes sense. I just kind of felt so heavy from the weight of it. And it was hard to kind of distinguish between the two, like, you know, if I was grieving for one over the other, or if it was a mix of both. It was hard. It was really hard to kind of separate the two. But I suppose what emerged was, because there was a bit of preparedness for the loss of my relative, I was able to compartmentalize that more than I was about the sudden loss of my friend, because I was still trying to make sense of what happened. And in my mind, because it shouldn't have happened. And so my reality was kind of shaken a little bit, because I was facing a world without her in it. Whereas with my relative, it was well over a year of preparing for the fact that, you know, this will take his life. Where my friend was just so sudden out of the blue that my reality was just shaken, and something I just completely wasn't prepared for. So that one probably overshadowed the grief of my relative, because I was grieving for her, but I was trying to make sense of my new reality without her in it, if that makes sense. The gap was probably about 2 weeks. Oh, Mary? Yeah. So the gap was about 2 weeks, and I probably, what would say which weighed more was probably my friend, because, yeah, it was just so sudden. So that kind of weighed more. But then I also did question whether or not I was grieving enough for my relative, because I was still quite upset about the loss of my friend. And it was kind of hard to feel like I wasn't disrespecting one over the other, and vice versa. But I think I also knew that, you know, I love them both, and how I'm dealing with it is just how I'm dealing with it, and how I'm processing everything at the time, and trying to be kinder to myself. But yeah, so in regards to working, yeah, I was teaching at the same time. I was working. I was also doing my PhD, and I was also doing my art and stuff as well. So I tried to keep as busy as possible, but also still allowing myself to feel how I felt, because I do know that, you know, if I tried to ignore it for too long, that it would just come out in other ways. So I channeled my grief, and like my, you know, so I just wasn't sitting all day every day wallowing. I did, you know, force myself to be productive and try and just, you know, keep going, and, you know, one day at a time, next step sort of thing. So yeah. Now, route, yeah. So now I think we would, because I think now this time has passed. Now time has passed. I think it's more of a celebration of life. Like in my friend's like aspect in relation to my friend, I have talked to my other friends about it, and we're just going to celebrate her life and talk about our funny experiences with her and that sort of thing. It's probably going to be sad. There's probably going to be tears, and probably a bit of frustration and anger and whatever else that may emerge. But it's more about celebration of life, because we did have a moment of just trying to process her grief, process her loss, when it did happen. And that was via like WebEx and Zoom and phone calls and things like that. But getting together may be a different experience, because we're obviously all in the same space. And it's kind of acknowledgement that she won't be there, and that will probably be a different type of feeling, because her presence will not be there, and she had such a big presence. So it is definitely something we're definitely going to do it, because that's exactly what she would have wanted us to do anyway. So it's just something who she is, and we talked about that. So we're definitely going to go and celebrate her life, that's for sure. I'm not sure how things are going to go now with everything. I'm still a little bit cautious of having too large of a group and being around too many people, which is, you know, my own personal preference. But yeah, I suppose that's kind of, yeah, if that kind of makes sense.
It does make sense, Ashley. It really does. You've articulated it extremely well, and it must have been really intense. So again, thank you, and I'll see you tomorrow. Okay, I'd like to now bring in and introduce Karen Anderson. Karen is a lecturer and unit coordinator for counselling and psychotherapy at Edith Cowan University, and also a psychodynamic psychotherapist in private practice. So welcome, Karen.
Hello, everyone, and hello, Moira, and well, yeah, it's lovely to be with you all.
Yeah, and lovely to see you again, Karen. We've had many conversations over the years, as you know, in a variety of places, from a shopping centre to UWA and where we used to have the yearly, I suppose, celebration or acknowledgement of people's losses. But apart from last week, or the week before last, we've not had these conversations during a global pandemic. So I'm interested about your clients' experiences, but also your experience as a health professional, as a person during those months. So I want to start by asking, if that's all right, about your clients, and I'm sure this is varied, but how do you think, in general, your clients travelled during this time?
It's a good question. I think, to be honest, I think there were stages. And I think the stages that the clients travelled, I unconsciously travelled as well. And having talked with different colleagues, the early build-up to what was happening, I think the important thing to note was that it was a very quick transition from functioning in our normal way to suddenly not functioning and going into lockdown. And I remember the date, Monday the 23rd of March. And seeing clients on the Friday before, not knowing still yet where the direction was going to be, but taking the responsibility to talk with them, should there be a lockdown? What would you prefer? How would you prefer to meet? And the difference between meeting with clients with compromised immune systems, such as my oncology patients or palliative care people, as compared to regular clients dealing with other types of issues, and making everyone aware. So I believe that in that very early stage for my clients, I think the escalation in anxiety was extremely obvious and very terrifying for many of them. And especially, I must say, for the palliative care and oncology patients. Over the 4-week period, I lost 7 clients, and the families of those clients and the clients themselves, I believe now, and I'm curious about what the long-term impact will be, because at the time there was an obvious heightened anxiety that they shared and talked about, that the family talked about, the depth of grief in terms of, and in fact, the article that I wrote that ended up going into the Weekend Australian and into the West Australian and many other papers, I asked 2 clients, and I remember feeling very nervous to ask them. It took me about a week to think through, do I ask or don't I? What ethically am I imposing upon them? And yet each of them, when I did ask, I felt that the 2 that I asked had a resilience or a capacity to be able to share. Interestingly, both of those clients, one a male, one a female, both middle-aged, had experienced fairly recent in the last 5 years a loss of significance, and now this was another significant loss. And so they were very anxious, they were very thrown around, and the way that we dealt it in the room was to acknowledge that I also was thrown around, that this was something different than either I knew or they knew. So whilst we were talking about their grief and the experiences of their grief in the pandemic, it seemed to ease in the room when I spoke to them, well, look, I don't know how to be in this either. And I think that eased my capacity to be present with, as well as ease them to be able to talk about the reality rather than of what they were experiencing now, rather than talking, if you like, about a grief experience. It was grief, but it was grief in a pandemic that raised a lot of the unknown about where to from here, which could not be answered. So, oh, you're mute.
For a change. What you said there that towards the end, I just want to follow up on that. Do you think that your clients, people in general, do you think that they felt that they were unusual in feeling that fear, and so you say, and being thrown about, and so you reflecting back how you felt, almost not normalized, but it's not a normal situation, but almost made them feel, oh, right, it's not just me. Do you think that was part of what was happening?
I haven't thought of that question, so you've raised that now, just now, for me to reflect on. And I think one of them, or several of the others as well, as clients, I think, yes, you're right. And yet I've not actually thought of that. And I know the reason I haven't thought of it, and this might be true for others listening in we all work in this field. So we're all exposed and much more familiar with death, with the dying process, with separation. One of the palliative care physicians, when he rang me quite anxious to do some work for him on resources, I could hear it in his voice. And he said, Karen, you and I are used to losing maybe 8 to 10 people in a week, when we're at the hospice. But I'm talking about preparing a COVID clinic at Joondalup where there could be up to 35 losses. On how doctors and nurses that are not familiar with death in a palliative setting dealing with it. And I was surprised by his anxiety. So that was one in that late part of February, early March. And then in my own peer supervision group, which are mostly, highly skilled clin psychs and a psychiatrist in a group. And on that last Friday afternoon, when I met with them, all of their anxiety was through the roof. And I remember thinking, I pinched myself and thought, what's wrong with me? Why aren't I feeling this level of anxiety? And I think it is because of the exposure we build up over the time, that there's a part of those of us working in this field that are more at ease, not totally at ease, but more at ease to be present with the vulnerability and the fragility in the human condition. So with my clients, that I remember that first week very solidly from Monday the 23rd, and that's when it started to hit, because the external world around me was reverberating with the pandemic fear, and yet I didn't feel it was penetrating. By the Wednesday, it was penetrating me. And so I think the way that you said that is beautiful. I think you're very accurate. I'm going to go away and think about this now. That I think my unconsciously just sharing with them that I was in this and I didn't have answers and I didn't know, and none of us have actually ever lived in a pandemic. And the word that was being floated around very consistently was unprecedented. It was being used everywhere. So I kept coming back to, well, if we don't know how to be in the next moment, what we have is this moment. And so that's what we used in our sessions. And you're right, I do think that helped.
That's really interesting, and I love your focus on language. Yes, it's or discourse. It's unprecedented, and bubbles have emerged.
Yeah.
And
Yeah.
but I really like your term. It's obviously not a pleasant concept, but the term to describe it about reverberating. Fear was reverberating. That's what it felt like, almost pulsating. It had an energy of its own.
Yes.
And that can be scary in itself. So it has a knock-on effect, I suppose. So I spoke briefly about, and leading on from that, about the emotions. I spoke briefly about the literature and the emotions. But literature can be very dry and very, very kind of removed. Mm. So if you're, in your experience as a health professional at the coalface, what were the key emotions you saw and heard? And the fear you've mentioned, but...
Yeah. To lead into that, if I could just say a little bit first, because by the end, that Friday after the Monday, it came very present into myself, these things that I fall back on. I've been very fortunate to do training and have supervision with Irvin Yalom. So by the Friday afternoon, what came to the forefront were his 4 ultimate concerns in life. But it wasn't me looking at the clients dealing with their grief from those 4 concerns. It was more, hey, this is for the first time I'm realizing this is about the therapist and the client in it together. And then when you were talking tonight, I've written them down. I couldn't believe what's come out of the research that you were saying, because they are all encapsulated in his 4 concerns, which of course is, one is death and dying, and ultimately he talks about the core existential conflict in the tension between the awareness of the inevitability that we're all going to face death, and yet we all have this wish to continue to be. And so the fear that comes up was very present. It was palpable in the room, in every session. Freedom, you mentioned, and he talks about, you mentioned alienation and meaningfulness. All of these are the four concerns. So the next one was that he refers to as freedom, and he talks about the clash between our confrontation with groundlessness and our wish to be ground and structured. And so again, there's fear, but there's also anxiety. There was a lot of anxiety about, the world is coming to an end. Literally, some people were actually saying it feels like the world's coming to an end. And your word bubble, I feel like I'm isolated from everybody else, and I don't know. I'm getting it through the news, on the radio, or in the TV, or on social media, but out there the streets are silent. There's no cars, and I'm not going anywhere. So there was a lot of that sort of feeling groundless, not here, but living here and trying to work through it. And then he refers to isolation, which you mentioned, that sense, and Ashley mentioned, that sense of being so alone, and yet everyone supposedly feels in their own home safe and secure. And yet in those first weeks, people were talking to me more from a relational base. So it was very relational based, of missing kept coming up, love, not being able to touch, the physical touch was phenomenal, not just for the clients that were going through illness and dying, but also regular clients, young couples, through the Zoom, through even the space between what we've got now. We're in connection, but there's a device between us. And some of them were talking about it feels alienating, having a conduit between us. I forget the words of one chap, of what he said. I can't bring them to mind right now. But this is a man in his 50s, quite articulate, but very grounded. and feeling quite separate. He said he was missing his kids because in the house he could be there, but they couldn't conduct themselves in the way that they normally do, going to school and all of that. So all those emotions that you listed were absolutely there and expressed, but they kept coming into these 4 ultimate concerns I noticed very strongly. And again, both you and Ashley have mentioned the meaninglessness and that conflict between the dilemma of all of us are meaning-seeking individuals as humans, but we're thrown into a universe that somehow is starting to lose its meaning, so its sense of understanding. And so out of that, several clients, or probably in different ways, nearly all the clients have spoken about vulnerability and fragile and coming to the end of the world. So feeling very, very, very fearful from an existential basis. To me, the encapsulation of the last 4 months has been thrown us right into the face of existential concerns.
That's absolutely the case, isn't it? That these concerns are existential. They're not necessarily, they can be practical, but they're not necessarily practical or pragmatic. Rather, they are existential and almost spiritual. How do I make meaning in my life? There is a definition of spirituality that talks about meaning making. So that's really interesting. And yes, our existential world was shifted sideways and will be for some time, even in a place like WA.
Totally, yeah.
How do you think your clients feel or felt about using telehealth?
I put it to them on that Friday before the shutdown. Several of them that were not ill patients wanted to keep coming. And so I negotiated with them a way that we could both agree on the distancing and meeting the requirements. I downloaded it quite immediately and laminated the government handouts and stuck them on the entrance and set up a station just with my own handwriting, because at that stage I don't think there was a notice, and asked that they use that. By nature, because it's interesting, by nature, because I've worked with oncology and palliative care patients for so long, in all my years, I have those wet wipes and I go around every morning before sessions and wipe all door handles and all of that because of people's compressed immune systems. But I was surprised that many of my colleagues looked at, when I said that, they were shocked. They were only just starting to do it because of the pandemic. So I think that was something else I observed. Whereas my clients were quite comfortable. Many of them did start doing Zoom and or Skype, and there was some bumpiness at the beginning, but they preferred to have that than to miss sessions. So, and then a couple of people in remote areas did telephone because it kept dropping out at times. So they moved from not seeing me. Some of those clients fly into Perth and see me while they're having treatment and then fly back to their areas, or drive. And so the telephone was different to the Zoom even.
And you were talking when we met and just before we had this session about how you felt. Sorry, I thought.
Yeah, sorry, no.
How you felt in terms of using the different systems and platforms and ways of communicating. Do you want to speak a little bit about that? Because that's
Okay. I think I thought I was fine with all of this, but what I only realised it on one clinic. I only have one clinic day on Fridays. The other days I'm at the university, and I had 7 clients. And I had Zoom, Skype, telephone, and in person. But I had them, I think I started the morning with a Skype, then had an in-person, then had a telephone, and then had a Skype, and then had a Zoom. And by the end of the day, my head was spinning and I was thinking, what is going on? And it was because they're in different parts of the room that I work in. The telephone's in one on the desk, the Skype was in one section, but the Zoom computer was over near another outlet in the wall. And I realised the pressure on my own brain was, as you said, platforms. It was my different parts of the brain using different platforms require different functions. And so the concentration became very intense, which rightly or wrongly, in somehow it benefited the clients because I became far more present in every session because I was actively working at it because I could feel the stress, the pressure within myself. So that's something that I remember noting and learning from.
And what, I'll call them strategies, but what did you do to support yourself in that scenario?
Mm-hmm.
So when you were really, really exhausted, or was it intense? What helped?
Yeah. So one thing is I had the room set up before. So I'd always make sure that was done a good half hour before the beginning of my first session for the day. So I can't do things, you know, further along and just go ad hoc. I had to have it set up. Then I felt like that provided me with a scaffolding. I have a tray with a water jug and glasses. So the clients in talking also, especially with people on chemo, sometimes get the dry mouth. So having that was there and always having my jug full. In between sessions, even if it was just for a few minutes while somebody was in the waiting room, I would go outside and I would take 3 deep breaths to fill my lungs, because on that run, you're sitting for a long time, you've been inside consistently in the lockdown rather than necessarily outside. So filling my lungs with oxygen, I found I had to do. It was compulsive. Otherwise, I felt like I couldn't think or be truly present unless I was fully into this part of myself. And then at the end of the day, I'd take the dog for a walk. I had to be in nature.
I have to say, you've got a puppy to take for a walk. Another self-care strategy.
Yes, yeah.
So what would you suggest? Well, actually, first of all, have you spoken to colleagues about what they did to support themselves?
One thing that stands out from a group of colleagues of mine is they, and admittedly, their practice is more, that's their business, and so they're more full on than I am. Since May, nearly all of them are taking 1 day a month where they're not seeing clients. They've crossed out a certain day in the week for every month from here on. They said they're going to keep doing it because they just feel they need that space to cope with, one, the platforms, but also the embodiment of pandemic thinking and feeling that we're imbuing into ourselves through media, through everything. And that's even here in WA, where we're really very isolated and done very well. There's been a lot of discussion just in the last few days by colleagues around the Four Corners report on Monday and on the Italian situation, and how feeling emotionally incredibly impacted by just knowing that, you know, professional colleagues that we don't know went through what they went through and are continuing to deal with the aftermath. And I think importantly here, and I mean, you in some of your research, and certainly in an article that Lauren Breen wrote too, it's, you know, I can't but say there's going to be a longer term impact in terms of grief. I don't know, I know the word tsunami's been used. I know that prolonged grief disorder is being used. we can't see it because we're not yet there, but I am pretty certain, and I know Catherine Shears, Dr. Catherine Shears in Canada, she did a wonderful, she was interviewed, and she also has said similarly that we don't know the outcome of the grief, not only for people experiencing their personal grief, but for us health professionals working in the field, be it not only in therapy, but as GPs, as doctors, nurses. We've had to hold our professional self whilst also dealing with quite a plethora of personal self and amalgamate them in order to hold and contain this anxiety that is at a global level, not just a regional or local level. So I think we're being called upon to do quite significant work.
I agree. I think that obviously health professionals generally are people at the end of the day, but this seems to have meshed together the personal and the professional in a way that perhaps is different. I mean, some people may experience that in an ongoing way, but this is highlighted and foregrounded, that intense distress and need to move quickly and make difficult decisions. And what you were saying about complicated grief or prolonged grief disorder and all of those things. There was one paper that went through a lot of the things that we know from the past. So people losing people who've died in ICU or in hospital generally are more prone to complications of grief. And all of these things have been, again, foregrounded and brought to the front of life. I'm going to ask one more question. And we can then open it up to the floor for people to ask questions. I have got several others, but I'll save them for when we meet for coffee again, because I'm really interested in our experience. What would you say to colleagues during this time, but also moving forward into the future? What would you suggest that are, I mean, you've highlighted quite a few things that are positives and for self-care. What would you suggest, what tips would you give people for moving forward?
Oh, you've stumped me. That's an interesting one. And especially because I've been thinking in my own world and mind, but also talking with others. You know, the pivotal thing for all of us is to note the experiences as we're having them, but what do we learn to take into the future, which is what your question is directed towards. And I think it sounds so corny and so simple, but very often complexities are solved with the simplest of responses. And I think it is about coming home. That if I can learn, and all of us now, everyone has experienced themselves in a very tense environment. It's something that in the past people going to war would experience. But now everyone on the planet has experienced the threat to life so immediately as in this pandemic. It's had mammoth and continues and will continue to have mammoth socio-political consequences. And so I think with all the external distractions of it, the one thing I would say is if I can come home to myself, if each one of us can come home to myself, we might not have the answers for ourselves or for others, but we're connected. And if I'm connected to myself, then I've got a better opportunity to connect with a person beside me. And therefore, in that sharing can come some ability to respond to whatever gets presented, I guess.
Oh, that's a fabulous response. I think I really like that, coming home to yourself and being connected to yourself as well as others. Yes, that's a lovely end to our discussion, but there are quite a number of comments here. Can you see the comments, or shall I read? You can see.
I can see, but my eyes are a bit blurry tonight. I think I've got a bit of sheen. So where are we?
My eyes are always blurry, so. I can read them out if you prefer.
There's one there from Root at Silver Chain. Suggestions on having complex conversations with clients over the phone and missing out on non-verbal cues. I think that's a very valid question, and obviously in telephone and even in Zoom, there's only so much that we can see. So I think, again, the answer is, how do I, as the health professional person, bring myself to be truly attentive? So, for example, in Zoom, telephone, you have the phone to your ear. In Zoom or Skype, you will see I've got headphones on. I use these all the time, and I get my clients to use these. And I learnt this from some psychoanalytic people, is that, and practicing from a psychodynamic aspect, is the unconscious is more internalized, as we hear when we've got the headphones on. So when I'm listening to you, Moira, I can actually hear you inside myself. So I get a better, to answer Ruth's question, I'm getting a better sense of the internal world if I'm very present with them, rather than hearing the lawnmower going outside or something else that could be happening outside. So it just finely tunes me even more into the present. So, and to continually stay naive, I call it the naive inquirer. It's a psychodynamic role, which is being curious. You know, if I had a client on the telephone talking and I heard a clunk or something, I might say, "Oh, are you okay? Was that, is that someone at the door you need to answer, or is anything there?" I'd pick up on the clunk. What was the clunk? And we'll talk about it so that the broader context is incorporated, even though I can't see it. I might hear it, but then there might be things I don't hear and I don't see. So in terms of the complexities, it's a tough one in answer to your question, because, maybe in this moment, there may be a really complicated or complex aspect to what they're needing to talk through, but perhaps they're choosing not to talk through it in that moment. And if I'm feeling that something's being held back, I will sometimes say to a person, I could be off the mark here. You help me out. Is there something that you're wanting to say that you're not feeling comfortable to say, or you're not yet able to say? So that's how I get around it in terms of a telephone response. Are there another one? And less. Okay, so do I see the changes made in practice will continue? To be honest, as a quick response, I would hope so. I hope that I'm staying open enough to learn from everything that's happened, and I hope everybody else is. I think the biggest challenge of what we're dealing with is in response to that existential concern of Yalom's, is that we've been made groundless, and everything in us wants to go back to the past. And I hear it in social arenas, in shopping centres and things. People just want to get back. They're sick of hearing of COVID. Well, the reality is we're never going back. We're not going back to the way that we live. So how can I take and learn from and continue to grow from the experience? So already here in WA, some of us have been talking about, and in awareness, if you notice your awareness, how many people are doing less hand sanitisation, less washing of hands now. It's like we've become a little bit complacent. And it's a reminder to find a new existence and learn from this and carry it forward. So yes, I think there will be more telehealth. I think one of the good things of pandemic, of this experience, and particularly I'm a country girl, so I'm very supportive of remote and rural areas, And I think this is waking us up that there are advantages that need to be utilised to support people in remote and rural areas, especially in this big continent of Australia, but also in the work in India where I've worked and continue to work. I've been astounded at how they're using apps in very poor regions on mobile phones to get messages around treatment options. So I think telehealth will advance. I don't think it will be replaced. I don't think telehealth will replace face-to-face, but I think there'll be more acceptance of it. I would like to think so anyway.
Now we've got a couple of comments. Does anyone want to put their videos on so we can see your faces, if that's okay? And I'll read out a couple of the comments that have been put on the chat. So shared acknowledgement of counsellor and client equals deeper therapeutic relationships. So that's reflecting back, Karen, on what you said earlier about that, disclosing that you felt being moved sideways as well. And then from Maureen, thank you, Karen. I like how you incorporate the clunk. That makes a lot of sense. And thanks. And from Renita, hi Renita, I know Renita. Working online was especially difficult when working with children and adolescents. So do you work with children and adolescents, Karen? Do you want to comment on that?
I started my career as a child and adolescent therapist, but I don't so much. But I'll share with you an experience that did happen, and it really threw me during the middle of the pandemic shutdown. I had a call, and who knows, the psychologist might be here. I came home from a supervision group on a Friday night, and I had... along and short of it, I had a referral from the husband, and a message and on my mobile, and a message on my office number, which I checked. I always check. And it was from the wife. And the wife, I didn't know at the time, was actually in hospital, critically ill. And the way she was talking when I rang her, she was wanting to have an appointment. And I was interpreting it as we just talked, that she was wanting an appointment for herself to tell her children. And yet I could hear heightened anxiety in both of them. And without going into the whole story, overnight I thought about it, and I rang the husband back in the morning. And he explained she had been diagnosed back in December with breast cancer, and on the Tuesday of the Friday night before the Friday, they had been given the news it had spread to the spine and the brain, and her time was very limited. She was actually in hospital, and her specialist sent me an email on the Friday night too, as did her psychologist. Please, can you see this woman? Now, for me, what I faced in my own supervision, ethically, I don't run a practice on Saturday. And so I started to think, I realised in that morning conversation, they were wanting a session together as parents to tell their children. Their children was a 6-year-old girl and an 8-year-old boy. And so as I talked to the father, I said, well, sometimes it does work better if a health profession unknown to the children tells the bad news, and then you can be mum and dad. And later in the future, the children can think that lady that told us that terrible news. So I pondered, and I made a decision on the spot, and I went to my rooms, and she had 4 hours out of hospital on that Saturday afternoon. He picked her up with the children. I did get them to bring a soft toy, each of them, told him to get them to bring something that they both love. And the 4 of us sat in the consulting room, and we talked a little bit about what mummy's been through. And then I told them that their mummy was going to die. And they fell apart into mummy and daddy's arms. And they were just the most beautiful family, beautiful kids. And they left to go. It was 40 minutes. I didn't charge them. I broke all my therapeutic frames. And they went out. And then on the Tuesday, I got a call from him to say the staff had called him in and she was dying. And he wanted to know about the children. I said, look, take the children, but talk to the staff. The staff will help you. Encouraged all of that. She made it through that night, but she died on the Thursday. And now, and as my own supervisor said, I'm so glad that I did it. And I think it's terribly difficult. No time is a good time for a child to be told complex things, or that they're losing their mummy or daddy, or even their granddad or brother or sister. So there's no right time. And sometimes, and I think that's something to carry forward in a pandemic crisis lockdown that we were in, the frame needed to be shifted in order to be available therapeutically to do the work. I didn't understand it in myself at the time. I needed to process that afterwards, and I did, and I felt better for it. But I think many times in hospitals, doctors are currently have been and will continue to stretch boundaries in order to provide the support that we need to provide.
Thank you for that. Thank you for that and sharing that. And thank you, everybody. I've just got one final comment to read, and then we'll move to ending the session. Thank you, Karen. I don't know whether you've heard of MHA. They offer a course online, disaster mental health counselling, enhancing your clinical skills, 31 hours, psychological first aid. Other things for mental health crises and healthcare services. So we'll send that link back.
That would be good.
Evaluation. But I'd like to thank you, Karen, very much, and Ashley as well, very much for sharing and being so articulate and so well informed and giving us your stories. And I'd like to thank everybody for coming. And again, I thank you all who have been working in the front line in such a magnificent way. And I hope to see you next time. And please don't forget to fill in your evaluation forms. That will inform how we move forward. So, and thanks to the Cancer Council, to WACOG, and thanks once again to the Health Department of WA. So on that note, it's 6:59. I'll let you go, and I look forward to hearing from you all. Any suggestions, comments, please get in touch, and we'll send some papers and links around. Thank you.
Lovely. Namaste. Thank you.